My area is really epidemiology of ageing, so that covers how health and diseases, particularly disability, change with age, their relationship with survival, and what are the consequences for health and care services. So my research programme that the AXA Research Fund funded was a chair in longevity and healthy active life. And I think the important bit is the healthy active life, because the big question is whether we're living longer, healthier, whether the extra years of life that we're living are healthy ones. And if they're not, that has big consequences for care needs in the future, and for other things like pensions as well. My work isn't just UK based. I do work on inequalities in healthy active life expectancy across Europe. So really trying to work out how we can learn from each other, because there are countries whose life expectancy is better than ours and their healthy life expectancy is worse than ours, or vice versa, and we want to know why that is. Governments become very, very interested in healthy life expectancy, and I've just completed a review on trends in healthy life expectancy for them. There was a House of Lords report a couple of years ago called Ready for Ageing, which reviewed how ready the UK was for its ageing population. Came to the conclusion it wasn't, and I've provided a review of healthy life expectancy trends to try and see what might happen in the future. For delivery of healthcare, I think the biggest challenge is the fact that very old people, and there are more of those now than there ever have been, tend to have more than one disease, so we call that multimorbidity. So they don't just have a single disease, and our health service was never set up to deliver care for multiple diseases. And so I think that's the big challenge. But it's also an opportunity in that we can think about people more holistically, because many of the risk factors are risk factors for multiple diseases. So obesity is a risk factor for dementia and for arthritis and for coronary heart disease. And so maybe we can start looking at the whole person rather than just considering them to be a collection of organs. And that's the way, in fact, our health service tend to look at people at the moment. I think the challenge for them is they want to know on average what's going to happen to a patient. They want to know how much care and for how long and at what intensity. And that's quite hard to get a handle on. But there's been a big growth recently in simulation models to try and look at that and under different scenarios. And I think one of the opportunities that that's bringing is it's identifying what data needs that we have and where the data's lacking. So I think that's going to drive better data in the future.